Hi, this is Dr. Stephanie Waggle here. I'm going to talk about two sets of issues that occur when treating somebody with psychosis, which is also a schizophrenic picture, schizoaffective, if somebody's on an antipsychotic, basically. So there's two things that's going to be going on. So we have issue A, which is the psychotic symptoms. So these can be confused with issue B, which are actually the side effects of the medications, because unfortunately, sometimes the side effects actually look like the disease itself, and vice versa. So if we just go through issue A, which is psychosis, and these symptoms are actually pretty urgent. So it involves a lot of disorganization, disorganized thinking. So we have poor insight into diagnosis. So people oftentimes don't think that really anything's going on or that anything needs to be treated. Difficult starting tasks. People aren't brushing their hair, brushing their teeth, showering. These are not the technical phrases. I just put this in the layman speak. That's why it says less words. So people aren't talking as much. Social dysfunction. So basically, people aren't having the interactions with friends and family that they used to. Monotone, that their voice is different. They believe in things that don't make sense. They don't have a different range of emotions, which is what the technical word that we would use is flat, but just for the general population, we will call that decreased range of emotions, less pleasure. People are confused. They're not really motivated. And then the one that most people do think of is hallucinations. And then just people aren't able to engage in their normal daily activities. So if we go to issue B, we see that some of these things are like similar. Sleepy, tired. So weight gain is actually pretty specific to the antipsychotic side effect. Weight gain isn't a typical issue that is from the actual psychosis itself. That's from the it's from the medications. So being sluggish, muscle rigidity, that one is actually pretty urgent to get checked out. Uncontrolled movements, that one, well, any of these you definitely want to get checked out, but anything going on with movements and muscles, you want to get looked at ASAP. Increase waist size. So when I prescribe an antipsychotic, I actually take the person's waist at baseline and then compare it after a while just to make sure that it's not increasing. And then breast milk. So some of the antipsychotics can cause what's called galactorrhea, and that's basically you're producing breast milk. So that's a side effect of the antipsychotic. So there's a lot of issues going on, and sometimes it's really hard to tell if it's somebody who their psychosis isn't completely treated and they're having symptoms of psychosis, but simultaneously having side effects from the medication for psychosis. This tool is just should help tease out a little bit of the differentiation between the two, but sometimes people describe, quote, zombie-like behavior from taking antipsychotics, but the, quote, zombie-like behavior can also be a symptom of the psychosis. So it's really important that an actual trained medical mental health professional makes the differentiation, but I just made this as a visual aid to try to help people and especially family members understand the negative things that are going on, because sometimes people just blame all the problems on the medication, and then when I try to increase the medication, they'll say, why are you increasing it? It's causing all these side effects. It's causing all these issues. But a lot of the times that the issues are that the psychosis is not completely treated. And that is why the medication for psychosis needs to be increased. And so when I do the increase, the problems that are a result of the psychosis then become treated and get better, but then you're still left with some of the side effects. So it's a balancing act, but hopefully this infographic will help you to better understand what is going on.